Hi everybody, it's me Madhavan KS and you are watching the New Indian Express. Nowadays we are much aware about open heart surgery, but are you aware about the minimally invasive cardiac surgery? So from this interview you are going to know in detail about MIS and it's quite popular right now. And we have Dr. S.Thiagaraja Murthy from Ramakrishna Hospital, Coimbatore to discuss about it. Welcome doctor.
Thank you very much for inviting me here.
Thank you so much. It's such a pleasure for us. And first I have to ask, what is MIS and how we have to differentiate between MIS and open heart surgery?
So, minimally invasive cardiac surgery means any operation of the heart that is done without fully opening the front of the chest or the fully cutting the sternum. It can be only upper partial, or it can be on the side, or it can be from the side, what is called as a transaxillary approach, or the right anterior thoracotomy approach. So, any approach that involves very little cutting of the sternum or only partially cutting the sternum, these are called minimally invasive cardiac surgery.
When was minimally invasive cardiac surgery started by?
So it is a gradual evolution. So when the heart surgery started, it involved fully opening the front of the chest. And the heart surgery is only 60 years old now. So over a period of years, things started evolving. In the last 10 to 12 years, minimally invasive cardiac surgery started coming in as a big time into the mainstream. But even now, if you see, only about 10% of the cardiac surgeries are being done on the minimally invasive method. 90% of the cardiac surgery done in most of the centers are via the front of the chest by the conventional method of doing the full sternotomy approach. So, minimally invasive cardiac surgery is performed only by very few surgeons in the country and even all over the world. Even if you take America or Europe or England, only less than 10% of the surgeries are being done by minimally invasive approach.
How has technology contributed to MIS in cardiac care?
Yes. So, of course, over a period of years, technology has contributed quite a lot. So, the instruments are different. So, when you are doing a heart operation through the right side of the chest through a 4-inch incision, and you need to have good visibility, sometimes we use the camera, sometimes we use the special retractors, and then the instruments are slightly longer, and we call it what's called as a monoshaft instruments. So, suppose if you have a scissors, normally you put both the fingers inside and you can cut it. But monoshaft instruments, it's like a pencil and you have to press the top portion and then the scissor cuts in the front. Because to aid the operation through a smaller hole, the instruments have been converted into a monoshaft instruments. And that aided the minimally invasive cardiac surgery and also the perfusion techniques. For doing a valve operation, essentially we have to stop the heart for a period of 1 hour or 1.5 hours. But during that time, the body's blood circulation is maintained by a machine called a heart-lung machine. So, the heart-lung machine has to be used in any patient undergoing open heart surgery or a valve replacement, or for example. So, to do this heart-lung machine, we use it through the femoral arteries. Normally through the front of the chest, we use the aorta and the right atrium. But in case of minimally invasive cardiac surgery, we cannulate the femoral artery and the vein, and through that the heart-lung machine is maintained. The blood is taken out via the vein, the blood is pumped back through the artery.
Okay. Is it affordable for an average Indian? The
Of
surgery
course,
is affordable?
yes. Although it may be slightly costlier than the open heart or routine open chest operations, minimally invasive cardiac surgery is slightly costlier. But it is very much, it's about 10% or more. In many centers, even the extra additional charge is not charged. In experienced centers like us, where we don't charge extra for a minimally invasive approach, it's the same charge. Suppose if it is a valve replacement, the same valve replacement cost will apply. Whether we do it open or whether we do it minimally invasive, in centers that are experienced, we don't charge extra.
Tell about the success rate of MIS.
So, the success rate of minimally invasive cardiac surgery is as good as the open conventional method. Otherwise, this won't come in. Either we do the operation via minimally invasive method or via the open method, the goal is the same. And it has to be done, replicated with the same result. Otherwise, this surgery is a failure. The approach may be different, it's only a smaller approach, but the result has to be the same. Suppose if you are having 99.9% result with the open method, the same result has to be replicated here. Otherwise, we are putting the patient's life at risk. Even one additional death cannot be allowed.
Nowadays, we are much aware about open heart surgery. But MIS, minimally invasive cardiac surgery, is quite new for us. People having fear to attend this kind of operation.
So the people's fear come in one or two different ways. One of the things they might be afraid that this is a new method. So will it be successful or not? Should I go for? So that part is not there. It's been there for more than 10 years now. The technique has been established. The instruments are well established and the perfusion techniques are well established. And so they can, in terms of expert hands, right now there are enough expert hands are available and the results are replicable. So those fear may not be rational at the moment. So in centers that routinely do minimally invasive cardiac surgery, the results are as good.
Okay. Could you tell about the technology advancement in cardiac care?
So technologically, cardiac surgery has been advanced in the last over a period of 20 years or 30 years. A lot of changes are happening. So one of them is, of course, minimally invasive surgery, minimally invasive cardiac surgery in terms of valve replacement. Endovascular therapies have,
Could you repeat?
endovascular therapies, which means there are now valves available that can be threaded via the groin, taken up to the heart, and that can be implanted there. And stent technology has improved in the last 15 years quite a lot. And without even doing an operation, the simple coronary artery lesions can be dealt with by doing stenting. But when you compare stenting and bypass surgery, of course, the bypass surgery in terms of long-term results are much better than stenting. The stenting, if you put a stent or something, it can work for 2 years or 5 years.
Yes.
And then the stent, inside the stent, it also can become blocked. But when you do bypass surgery, you're using your own body blood vessels. So they tend to last longer. If you're looking at a long-term result, when I say long-term, I'm talking about 20 years. When you say 20-year results in terms of bypass surgery has stood the test of time and it is working much better than the stents.
I want to jump in this conversation. Could you tell about the robotic surgery?
Now, robotic surgery, although it is now come in a big way, but robotic surgery came even 20 years ago.
Oh.
20 years
In
ago,
India or?
in India and abroad also it came.
Okay.
But it failed big time. Because the technology that was not advanced, the robots were not as much advanced, and it was primarily introduced for cardiac surgery. And cardiac surgery, by definition, it is a difficult surgery, and robot was primarily introduced in cardiac surgery, and it failed big time. Because people are not able to adapt it, the cost was very high, and the failure rates were high. In fact, one of the important company which introduced the robot in all over the world is called Da Vinci. Da Vinci company has got the highest number of court cases going on in America because procedural mishaps or complications and the machine used to get stuck in the middle. So those things were happening and then they completely went down on cardiac surgery. And then they reinvented and the third generation robots are now coming in abdominal surgery, in prostate surgery, pelvic surgery, etc. But cardiac surgery is also being used in the current robotic surgery, but it is used in a very, very limited fashion. But in bypass surgery, the robot is used only to harvest the internal mammary artery. Whereas the actual operation of stitching the bypass graft is done by the surgeon. No robot can do that finer stitching because these vessels are very small. So when you say robotic surgery and cardiac surgery, people should not get carried away that the whole robot is going to do the entire operation.
Yeah.
So that technology has not come in yet.
What is your opinion about that? Because common people thinking that robot is going to operate.
No.
So what is your opinion?
That's what. Robot is not going to do the operation for you. It is the surgeon who is going to do the operation. The surgeon will be operating the robotic hands. But in bypass surgery and in valve surgery, only part of the operation will be done by the robot. The main part of the operation still has to be done by the surgeon by his own hands. The robotic hand will be used only for 10% or 20% of the operations.
Fantastic answer, doctor. And could you tell the difference between heart attack and stroke?
Yeah, this is a very important question that you asked because common people confuse both. They think that heart attack is same and cardiac arrest is heart attack is the same and stroke is also the same. But however, both are not the same. When you say heart attack, the heart is pumping machine and then the heart has got its muscular pumping machine. The muscles need blood supply. The oxygen has to come to the muscle, only then the muscle will pump. So the heart has got three important blood vessels, one in the front, one on the right and one on the left. If any one of these gets suddenly blocked with a thrombus or a blood clot, then the blood flow to that portion of the heart gets stopped. Once the blood flow stops, immediately the pain starts coming. Suppose if you run for, suddenly if you are not a runner and you run for 20 kilometers, next day you won't be able to move the leg. That's because of the lactic acid built up in the leg and it gives you extreme pain. Similarly, when the blood flow gets cut off, the lactic acid starts building up in the muscle and gives extreme pain to the heart. That's what is the beginning of a chest pain. And then once that happens, then your sweating starts, and then some people get unconscious and things like that. So the heart attack means blood flow in one blood vessel or branch of a blood vessel can get blocked off, and that produces intense pain in the heart or in the chest. So that is a heart attack. Stroke means it's completely different. It is from the brain.
Brain.
Yeah, the blood flow to one portion of the brain gets stopped. So suddenly you may not be able to lift your hand. Suddenly you may not be able to move your leg, or you may just suddenly become blind. Or one side of the body you might lose your sensation and completely go what is called a hemiplegia. So that is called a stroke. A stroke is an event that happens in the brain. Heart attack happens in the heart. So both are completely different. Yeah.
Why heart problems and stroke are very common in India?
Okay. Now this is also a very question, but these are a very long answer I have to give you. Now, see, India, as you know, it's a very populated country. So by sheer numbers, we'll be having more heart attack and more stroke. But the problem with Indians is that the Indians are a race which has got more of a diabetic problem at the moment. Because when you compare the history of the human history, such a refined food that we are eating right now,
Yes.
it's happening only in the last 30 years for Indian population. Before that, India was a poor country, purely agriculture country. They were eating only what is available locally. Now suddenly you are getting maize, corn syrup, you are getting pizza, pasta, you are getting rice all 3 times a day. Whereas the 30, 40 years ago, rice was not available to everybody all throughout the year. So they were eating ragi, all those things, local items, vegetables. Rice was reserved only for some functions, etc. So suddenly our entire population has moved on to a very refined form of eating with sugar. Previously, those days, sugar was not available in mass, this thing. So people are becoming diabetic, people are becoming obese. So all these are happening, and that is when the sedentary lifestyle. Previously, we were all an agricultural country and everybody was working in the fields. Now suddenly IT companies have come up in the last 30 years, everybody is sitting in the sofa, eating 3 times rice, 3 times with the sugar, coffee and everything, and your caloric intake is very high. So all these things led to so many different forms of diseases like, diabetes, obesity. So that leads on to the next level is the stroke, heart attack, all these things.
Doctor, what is your thought about smoking and drinking? Because nowadays everyone is
My thoughts about smoking and drinking, okay.
how a person should maintain their health.
No. See, healthy lifestyle is a completely different topic, and see, basically you have to have a weight control, you have to do adequate exercise. Now, of all these things, people are saying that, or the studies are coming out saying that exercise is the most important predictor of lifespan. Somebody is doing regular exercise, or they will be obviously living longer than a person who is not at all exercising in all terms of survival. Even cancers are less in people who are doing regular exercise. So that amount of stress is now getting onto the exercise regimes. And anything in moderation is good. Anything if you're doing it, overdo it, it will create problems. Same thing.
In anything means what?
Smoking and drinking. If you're taking 1 or 2 drinks a month or something or a week, that's okay. That's not going to create harm to you. But but smoking is absolutely bad when you do it, regularly or even occasionally. It can affect your organs in different way in terms of lungs and cause cancer, heart attack, heart disease,
Everything.
different types of cancer and everything. These things has to be avoided. If you want strictly speaking from the health point of view, I'm not talking about a lifestyle. When you talk strictly from the health point of view, smoking and drinking has to be avoided 100%.
Okay. It causes
No, it can cause heart problems, heart attacks, strokes, kidney failure, cancers, all forms of cancer from head to foot.
Okay.
Even drinking in moderation also can cause cancer.
Okay. Thank you so much for creating the awareness, doctor. And could you tell about any limitations associated with the MIS, minimally invasive cardiac surgery?
So the limitation of minimally invasive cardiac surgery or depending on the complexity of the operation.
Okay.
If it is a simple, straightforward operation, it can be easily be done by minimally invasive cardiac surgery. Suppose if it is only a mitral valve replacement, we can easily do it by. But if it is a double valve replacement, with another valve to be repaired, then it becomes a complex operation. It cannot be done by a limited incision. So these are limited, and patient's body habitus. If somebody is super obese, obviously we are going to find it difficult. It's better to go approach the operation through the maximally invasive approach.
Where do you see the future of MIS?
So if you look at the minimally invasive cardiac surgery, the future is there's going to be more and more surgeons who are going to be adopting minimally invasive cardiac surgery.
More surgeons.
More surgeons will take on this.
How they have to adapt?
No, how they learn these techniques is that they coming and observing a senior surgeon like me,
Okay.
or attending conferences,
Okay.
and going to a center where they are regularly doing these operations, watching them, and then coming back and doing these operations. Or get trained for 6 months or 3 months in a center where there's minimally invasive.
Okay. What made you pursue your career in MIS?
When I was doing the MBBS, the times were different. It was 1987, I joined Coimbatore Medical College. So, in my house, there was not even a phone.
Oh.
Every home did not have a phone at that time, because when you book a phone, you will get it after 15 years or 20 years later. Only BSNL phones were available, and that too with a big phone with a dial-up system at home. Wired phones were there. And communication was very, very remote and rare, and if something has to be done emergently, people used to send telegrams in those times. So in those times, our textbook used to be mostly in only words. Occasionally, out of 50 pages, 60 pages, one picture will be there. That picture will be of black and white. Even color pictures of even operations, everything never used to be available. One rare atlas publication might be there. That might have one color publications. Most of it will be illustrated or hand drawn. Because our cameras at the time were not that good, the pictures were not that good, and all those technological limitations were there. When I was doing MBBS and during the second year, that's when the first heart transplant happened. That became big news in the newspaper, and we were all, wow, even a heart can be transplanted. How? As a medical student, we were all like, thrilled to see that news. And in Coimbatore, there was no cardiac surgery at that time. Even in Tamil Nadu, that's when KM Cherian here in Chennai has just started cardiac surgery at that time. That was coming up in the news. So for us, it was all a fascination. As a young doctor coming up, oh, I want to do this. So that kind of motivated me throughout my career. And then we went to England and to study. I spent a lot of time in about almost 10 cardiac units I worked there. I came back. So that kind of motivation was there at that time. But if you want, nowadays you have all these YouTube videos of heart surgery, even you can see it.
Yes.
Even a common public can just Google it and they can see a heart surgery on the YouTube. But in those days, our conferences never had videos. We only had slides.
Doctor, how grateful to be a doctor?
It is a very, very satisfying profession in terms of personal satisfaction. So when you do a heart operation and the whole family and the patient, everybody thanks you, and then you really feel great that you have helped this patient. And patient suddenly coming with a chest pain in the middle of the night, and if you don't operate, he's going to die in 2 hours. And in those situations, you're stepping in and you're doing something, you're life changing to the patient.
Any particular incident about that?
Too many instances happen. You see, we are, as a cardiac surgeon, we deal with life and death every day. Every day. So, suddenly aortic dissections are kind of patients where if a dissection happens, you get a sudden chest pain, the aorta tears in the middle and that produces the pain. 70% of the patients this happens will not reach the hospital. They die at home. Only 30% will make it to the hospital. Among the 30%, even after coming to the hospital, only 10% will survive. So you get an alive patient with a dissection, then we do immediate CT scan. Even the patient comes at 10 o'clock, 11 o'clock in the night, we rush in, we do the operation takes about 4 to 6 hours. Like sometimes we start the operation at 12 o'clock midnight and finish at 6 o'clock. But if we have not done that, that patient would have died in 1 hour. A patient, 52-year-old, 56-year-old, coming with a young family. And then, so those sort of things, you really make a difference to the family. So that sort of gives a lot of gratification to you. And those sort of things only makes us going. Because it's a tough life, we make a lot of personal sacrifice and everything. So only these kind of events that, you get that satisfaction.
Understand.
Money in life and everything, that's a different story. Everybody gets paid. A computer engineer with a startup company, in 5 years, he'll make $2 million, $5 million. Obviously, he makes enough money to retire for his entire lifestyle. But in fact, I would like to tell you this. You take the Forbes top 100 list or 500 list of the rich people in the world, rich people in India, South India. Every year they put a list, right?
Yes.
You will never see a doctor.
Why?
Because doctors don't make so much money. But you will see the real estate guys, you get this guy, jeweler, cinema actor coming up on the top. Everybody will be there, computer engineer, Narayana Murthy, all these guys will come on the top. But in the top 500 names, you will never see a doctor all over the world.
Yes.
Because what drives the doctors is not the money. It's the thing, professional satisfaction. That's what gives them the satisfaction.
And nowadays, many youngsters are facing heart problems. So why is it happening?
That's what, see, the youngsters are having a heart problem. You go to a school, 10th standard. If you see, half the kids will be obese.
Okay.
When we studied in the school, the entire school, one boy will be slightly obese. And that guy obviously will be called Gunda. But now if you go to any school, half the kids will be overweight. Because the children are being fed this high sugar diet, high diet with a lot of proteins, carbohydrates, sugar and everything. So, and many of the family, they have one kid and that kid is overfed. And their kids don't run and play. They don't take any sports activity. They overeat. They get addicted to junk food. So by the time when you're 12 or 15, when you're overweight, when you're 25, you're already having 10 years of obesity going in your bloods. So you see people at the age of 30, 31 coming with heart attacks.
Because of obesity.
Because obesity and diet issues.
Diet issues. Okay. Is there any genetical?
There is a genetic component. In patients in whom family is having a diabetic history, or patients in whom father and mother have a heart attack at a younger age group, obviously the boy or a girl can have a heart disease at a younger age group. There's another set of patients called Marfan syndrome, or genetically they are having this very loose connective tissue. And those patients can have what is called a dissection, loose diet syndrome, some syndromes, or a Marfan syndrome. They'll be genetically tall, they might have this valve problems at a very younger age group. And many children are born, the newborn children also undergoes heart surgery. You must have heard about it. So by birth, the child can be born with a hole in the heart, because when your heart, when it is getting developed, inside the mother's womb, the circulation is different. You know why? It's a common sense thing. The baby inside the mother's womb is not breathing air.
Yes.
It's taking oxygen from the mother through the pipes that go via the umbilicus, right?
Yes.
So the child is getting all the nutrients, all the oxygen, and all the oxygen, low blood are coming back to the mother through the placenta. So until the child comes out and breathes the first time, the child doesn't take in oxygen. The lungs are in a collapsed state. Only when the child comes, that's why, see the movie, the baby comes out and cries and everybody is happy. Because the circulation changes. So until the time the baby is in the mother's womb, there is cross circulation inside the heart. Because the lungs don't need to have oxygen. But the moment the baby comes out, that wall closes and then the lung circulation starts. But in some babies, that closure will not happen. So inside the heart, that shunt will remain. And there are some other developmental anomalies of the heart where in which it can become complex congenital heart disease, what we call, where the left ventricle and right ventricle shunt will continue, or there's another tube that connects between the aorta and the pulmonary artery that will remain open, called patent ductus arteriosus. Or in some babies, during the development of the heart will develop upside down, or what's called a transposition of great arteries, where the cross circulation happens, where the oxygen, the high oxygen blood will be going to the lungs and the low oxygen blood will be going to the body, which is the opposite of what we are normally having. So in those babies, the operation has to be done immediately after birth. The baby will be 3 kilos, the heart will be like lemon size. So we have to go through that and refix the whole thing. So that's called congenital heart surgery, very tough operation. And imagine having the chest open for a 3 kilo baby who is only this big, and having them post-operatively, getting them out, getting them to feed, and then getting them to grow. So all these, it's a completely different field. So neonatal cardiac surgery or congenital heart surgery is a different field altogether.
Doctor, coming back to minimally invasive cardiac surgery, are there any specific cardiac condition who benefit from MIS?
Yes. So the valve replacements now by and far it's become the standard care for valve replacements like mitral valve replacement, aortic valve replacement, etc. But in bypass surgery, single bypass grafting via the minimally invasive cardiac surgery is very effective. Whereas multiple, like triple bypass, quadruple bypass, done via minimal invasive is not as good as what we do via the open method.
Most common procedures performed using MIS techniques.
The most common techniques are, that's what I said, valve replacement, like aortic valve replacement, mitral valve replacement, sometimes bypass surgery, and hole in the heart, like ASD. Like, some people grow up into adulthood and then come back for the congenital heart operation. We do close them using minimally invasive cardiac surgery.
Doctor, earlier you mentioned about the obesity. Is there any new advancement in losing the weight?
Yes. See, in the last 1 year or 2 years, two drugs have captured the world by a storm, basically.
Could you please
Yeah, I
mention the
will
name?
mention. The one is called Ozempic,
Mozambique.
Ozempic, Ozempic. The other one is called Mounjaro, Mounjaro, Mounjaro. The one is the tirzepatide, that's the Mounjaro. The other one is the glimepiride or whatever. So it's an analog of things where, it reduces your appetite. You will not be feeling hungry.
Okay.
And even if you eat a little, you will immediately feel satisfied. You won't eat after that. So basically, these two drugs, in all the research trials that have happened so far, have reduced 20% of the body weight in 3 months of taking this.
20% of
20% of body
weight. Okay.
Suppose if somebody is 100 kilos,
Okay.
they'll become 80 in 3 months' time.
Oh, is it harmful?
So far, the studies have all proven no harm.
Okay.
Occasional side effects can happen, like vomiting, nausea. But the problem is that once you stop this medicine,
Okay.
and if you don't control your diet, you will regain your weight.
Oh, okay. So
It's
the
not a problem.
diet is the major role.
Yeah, of course. If you eat more, you become. See, why are African children, their ribs are all showing? Why are they so thin? Well, there's famine. There's no food.
And can you share any challenging cases in MIS?
So in minimally invasive, there are many challenging cases we have done. Of course, in fact, to say is every case is a challenging case. But there are some patients in whom the heart is very dilated, a very big heart where, the approach is a bit difficult. Those are all the challenging cases. And sometimes in, moderately obese patients where the access is difficult, those are patients in whom we find it a little bit more challenging.
Could you please give advice for patients?
Advice in terms of postoperative well-being, obviously,
Especially after open heart surgery.
yeah, that's two different kind of groups of patients. The advice is different. One is patients who undergo bypass surgery. Patients who undergo bypass surgery, we advise them to undergo a lot of lifestyle changes. If they are diabetic, strict control of diabetes, walking for 45 minutes to 1 hour a day and doing multiple other exercises, reducing the weight, stopping smoking, cessation of alcohol, and then, if they are having any other issues that has to be controlled, any hormonal issues, those sort of things. So this lifestyle change is strictly advised to patients who undergo bypass surgery. In valve replacement, the advice changes depending on what kind of valve disease they have. So, older individuals who are having this degenerative heart disease, people who are above 70, they don't have to follow much of a strict protocol as such. Same way with mitral valve replacement, we give them a special drug which is a blood thinner. We regularly advise them to do blood tests after every 3 months. The dosage is titrated according to that. So, those sort of advice we give them.
Doctor, any final message for aspiring cardiac surgeons?
Yes, the aspiring cardiac surgeons, the advice is that a lot of things are being now taken over by the medicines and stenting. So our cardiac surgery numbers overall worldwide is coming down. The number of heart operations being done is getting less because they are getting treated with stents and medicines. These sort of weight loss drugs coming and diabetes is getting controlled in a better way. So the heart disease incidence can come down. And many things are being dealt with by stents and stent type related other things. So compared to 20 years ago, the cardiac surgery numbers are down. But the number of hospitals and the number of diagnostic centers have gone up and our population have gone up. So overall, if you see, the numbers are up. So for cardiac surgery, it is a long training program. So the surgeons who put their mind into it, they have to persevere for a long time. It is not something that you can learn in 2 years. It takes 10 to 12 years
For love.
to learn and to become a cardiac surgeon.
Any final message for patients?
So for those patients, who are having our heart disease or who are having suspicion of heart disease, they should go and approach the doctor early and get all these tests done. So any ECG, echocardiogram or a chest X-ray can give a clue. If somebody is having a chest pain, they should undergo a treadmill test and meet a cardiologist. Then we can diagnose or undergo an angiogram. It's a very simple procedure which can be done in 10 minutes. They can go home the same day. So early diagnosis, you get a better chance of good survival afterwards. Better to do prevention. So Tamil சொல்ற மாதிரி தான். நோய் நாடி நோய் முதல் நாடி. So first find out what it is.
Doctor, first of all, what is heart transplant?
See, heart transplant is obviously the name is giving away. Somebody's heart is so diseased that is not able to pump. The patient is bedridden. So you remove that patient's heart and put somebody else's heart. But obviously, heart is a single organ to anybody. I cannot take your heart and keep it for myself because obviously you will die. So the heart transplant is done. There is a recipient and there is a donor. So the recipient is the patient who is sick, whose heart is failed, what's called a heart failure, end-stage heart failure. Those are the patients in whom we select to put somebody else's heart. So whose heart are we going to put in? So brain-dead people. So obviously the patient, the donor will be a younger person who's driving a motorcycle recklessly without wearing a helmet, gets crashed, gets his head injured. And neurologists and everybody will say that, this guy is not going to wake up. His brain is damaged beyond surgery or beyond any repair. But his rest of the body will be all right. His heart will be pumping, his lungs will be all right, his liver will be good, both his kidneys will be good. So in those patients in whom certified brain death, in whom that brain cannot recover, with the consent of the family, their organs can be donated, can be placed on to somebody who's in an end-stage heart failure. So obviously this heart, it has to be matched, blood group matched. If there's a blood group matched and the patient has to be on lifelong anti-immunosuppressants.
Doctor, you mentioned about valves. So what are the types of heart valves?
So when somebody's got a heart disease and the heart valve is very damaged, either become very stenotic or leaking, we remove those valves and put in artificial valves. Artificial valves are two types. The one is a mechanical valve which is made of carbon. The other type is called a tissue valve. There are two kinds of tissue valves. One is a porcine valve which is made from the pig's heart valve. The other one is called the bovine valve, which is made from the cow's pericardium, the covering of the heart, which is processed and stitched like a human valve. So these are two types of heart valves that are available in the market. So they have different generations. The current generation is what's called third generation valves.
Thank you so much for this interview, doctor. Thank you.
Thank you very much.